Yeah, so this morning we told you that we're going to be discussing, what's going on with regards to the COVID-19 and how we're going to continue to get through and cope with this pandemic.
Yep,
And to help us
that's
do
right.
that this morning, Carrie is going to be chatting with Dr. Wheeler.
Yep, correct. I'm going to be chatting with Dr. Erica Wheeler, who is the WHO and PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler.
Good morning, Carrie. How are you this
Oh,
morning?
I'm doing quite well. And, there's some news that came out over the weekend that is a little worrying, and we'll chat about that in a little bit. But otherwise, I'm doing fine. How are you?
Great, great. I'm good. I'm good.
All right. So the Prime Minister, he gave some highlights in the press conference over the weekend, and some of it included that grocery, supermarkets, food supply outlets will be open 24 hours a day from December 10th, and so on. What do you believe with regard to this? What do you believe would help? How do you believe this would help, the whole Christmas rush and stuff like that?
Well, clearly it's good for businessmen, so that we, the public, need to be even more alert and aware of the spread of COVID-19 more than ever, because 24 hours means a lot more people with a lot more movement over that longer period of time.
Right.
Means we cannot by any means whatsoever drop our guard. If anything, we have to be even more cautious, because we have seen what has happened in countries in Europe like the UK. We've seen what's happened in the USA. Whenever there are large crowds of people coming together, there is usually a spike a couple of weeks after. So we do have to be very mindful that we continue with our new normal activities of masking up and hand sanitizing or washing your hands. Please do not go shopping if you are ill, if you have any flu-like symptoms. So we really have to be super cautious, I would say, because we will have more movement of people if you have 24-hour open supermarkets.
Don't you think, well, hopefully that although there are 24 hours, grocery stores and stuff, food supply outlets open for 24 hours, is there not a hope that, well, there would be lesser people spanned across the time rather than a whole rush in one period as we are seeing now?
Well, it depends, because there are people who work at night who will still have to shop in the day, and vice versa.
Right.
Yes, there may be maybe some people don't go to the supermarket at 2 in the morning, but having lived in the UK, I know that you can have a stream of people around Christmas time,
Right.
especially. I think it's the holiday, not so much, the regular weekdays, but it's the holiday time. So we are hoping that it would spread out, but you have parents with young children who won't be going to the supermarket at 2 or 3 in the morning. So that's why I'm saying that the public health measures still matter very much. Even if you don't have that volume, you still have to be careful, because there'll be much more movement over a longer period of time.
Yeah, and well, hopefully people do keep it under control and they still observe the measures, although we're in this festive season. And speaking of which, aside from gathering at grocery stores and shopping outlets and such, this is the time where we would normally, around this time last year, we would have gone over to friends and families' homes and things like that. What would you say is the worst case scenario coming out? I mean, yes, we have seen the rate of infection decreasing to some degree here, but what do you say is the biggest worry for this season?
Well, we do have to be cautious of multiple families gathering. It is, I am sure there's still going to be families who will have meals together, large families who will have meals together. But, we have been advised, even both by the government and WHO, that even when you have, say, two households gathering together, you still have to wear masks, except when you're eating or drinking. You still need to keep your distance, not to do the facial touching and so on. So I guess the temptation is always to have large indoor gatherings, which is not a good idea, because we still have the situation that indoors are less, or I should say more prone to spread of COVID-19 than outdoors. So, we have to keep up this mantra constantly of the mask wearing and the not having large groups of people indoors, because that is really a super spreader. If you have large numbers of people in Christmas parties, crowded inside of houses, that is not going to be good for the spread of COVID-19, because invariably people will forget, and especially if you're consuming alcohol, they will let their guard down. So we do need to be careful with indoor gatherings. This is to be discouraged, having large indoor gatherings for Christmas. It's not 2019 and before anymore.
Right. Yeah, so true. Now, onto the worrying data that came out over the weekend. There were 3 children hospitalized with a condition called MISC, and it has been said that it is, as an effect of having contracted the COVID-19 virus. What can you tell us about that?
Well, this is a bit of a puzzle. Even now, I think there have been something like 39 studies, but they've all been observational studies made since these initial cases in England in April. What it has shown is that whereas the peak of the infection took place 2 weeks after, which is what we know now, the 14 days. But with the multisystem inflammatory syndrome, the response came something like a month later. So it appears as if it is more of a complication of COVID-19. So it's a post-infection syndrome. This is what the results are showing so far. Although it's rather dramatic, and we are seeing a lot of heart problems, and children who get it end up, most of them, over 70% of them end up in ICU.
Wow.
The fatality rate is 1.7%. So it's not a large fatality rate, but of course it is still extremely worrying, because children who get it, they get vomiting and fever and abdominal pain, and they're usually around 9 years old, although it differs a bit. But the mean age seems to be around 9 years old. It could be a bit younger, it could be 7 years old, and it could be up to 14 or a little older as well. So they do believe so far that it is a post-infection syndrome, because when tests were done, the children showed antibodies. So it meant that they were healthy before they had the infection, and then as much as a month later, they had the symptoms of multi-system inflammatory syndrome. So we're still studying it. The studies are observational. They've happened mostly, the studies in developed countries, the USA and the UK. Unfortunately, yet again, it is showing that children of African Caribbean or African American descent have a higher propensity to get it. And those who are obese or who have asthma as well, they seem to be more prone to getting this multisystem inflammatory syndrome.
The COVID, that being a complication of COVID-19, is it something that the disease itself carries, or is it something that, well, I guess is more of a physiological issue?
Yes, it is, because it's the body's reaction in those children. And as the research shows, it is post-infection. So yeah, it is related. There is something called Kawasaki disease, which is similar, but they have identified that this is not Kawasaki disease that happens in children, which happens in much younger children as well, even though some of the symptoms are similar. But it definitely is related to COVID-19.
Wow.
and appears to happen as much as 3 to 4 weeks after children have COVID-19.
All right. Well,
so,
Dr. Wheeler,
again, this business of being healthy, we have to be very careful about our health at this time, because kids who are obese, kids with asthma are shown to be the ones who are more at risk.
all right, Dr. Wheeler, we're going to have to stick a pin in it there, but we are going to have a follow-up conversation about that, because, as things progress, we need more and more information, and of course, you at the WHO and PAHO would have that. But I want to thank you so much for joining us this morning and giving us this information. That was Dr. Erica Wheeler, who is the WHO PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands.